Hello, Richard.
Mike, thanks for having me on here. I really appreciate it.
I was like your fifth guest on your podcast.
It was early for me, and I appreciate you for that. I was just getting started.
So you were like the first or second on mine, and it was just on my phone, and I think halfway through, I dumped half of it. So I actually came on the end of the podcast, and I told my listeners, I said, I apologize. That's all we got, but it was too good to throw it away. So how you doing?
I'm doing really well. Living the quarantine life right now. I've only left the house to do some grocery shopping twice, maybe in the last 6 weeks. So it's been interesting, just kind of hunker down at home.
So we had some guy about a week ago, I was in the pharmacy, and he said he had not been out for like 3 weeks or something. And he was actually going around like a new puppy. I mean, he was going up to everybody in the pharmacy he could to say hello, and because he was so happy to get out of the house.
Yeah. Yeah, it's definitely, it's like we're living in like a weird twilight zone. I mean, even when I went to the grocery, I think it was about 3 weeks ago, it was just the particular grocery store I went to was just so dead. And I live in Miami, so I live in a very like busy area.
Yeah.
And like just to see like it was just completely dead, and everyone was wearing a mask, and it was just like, man, this is just a weird, kind of environment right now.
Yeah. The first week or so it happened, I physically almost shook my head a couple times. You couldn't believe it. You couldn't believe it was happening. Mm-hmm. Humans adapt, I guess. It seems kind of normal now.
Yeah. I mean, with everything, we always adapt. So that's one thing that's great about the human species, is that our nature is to always adapt. And luckily we have an ability to communicate. And, animals, they don't have that ability to communicate and adapt. When things happen, it happens. It takes evolution to like figure that out. But for us, it's an instant adaptation because we're able to communicate. So, I mean, from a holistic point of view, I mean, we're definitely in a good spot.
For those that don't know you yet online, tell us who you are and tell us why we're talking today.
Yes. So for those that don't know me, my name is Richard Waithe. I'm a pharmacist with primarily a background in community pharmacy. I went to school at the University of Florida, and primarily had a background in, again, like working at some of the large retailers like Target, CVS, Publix. Really started to see that patient education was a passion of mine, and really tried to focus on, how can I work with technology and work with making sure patients are understanding a lot about their medications. And VUCA Health for me was an interesting story because I was actually an intern with the company when I was in pharmacy school, helping them create some of the content. And then when I graduated and went off on my own, I started like an MTM company. I started to get into digital media production with the podcast, with RX Radio and things like that. And then kind of came back full circle where the founders asked me about a couple of years ago to come back and run the company as president. So that's kind of where brought us here today. In VUCA Health, what we do is we primarily focus on creating medication education content. We create medication education videos. But one of the ways that we get those videos in front of patients is by putting a QR code on the labels, working with community pharmacies, mostly independent pharmacies. The result of a new partnership that we engaged in with Pioneer RX. Now every single pharmacy that's using Pioneer will have a QR code on their receipt label. Whereas with most other independent pharmacies, it's up to the pharmacy's choice if they want to subscribe to the solution or not. But with Pioneer now, Pioneer's created it where it's now a standard for all of their community pharmacy, or all of their independent pharmacies, and it's a really exciting time.
How did you get your first internship with VUCA Health? Did you search that out or what?
No, actually, my beginnings with VUCA is actually just a testament to like my always ability to say yes to everything. And I feel like in most of what I do and all the opportunities, I always say yes to things. If I can either afford it or I have the time to go do it or take an opportunity, I say yes. The founders actually sent an email out to our entire campus for students, basically looking for students to help create the content at the time. This was back in 2012, 13-ish, around there. And I saw the email. It was literally out of a campus that had maybe 400 students. I think I was one of 4 students that actually replied and said, yes, I'll do that. Like, that sounds good. And that was kind of how, so I wasn't searching it out. But the one of the biggest reasons I said yes also was because as a student, they were like, the opportunity was you can write scripts for patients about medications and we'll pay you to work from home. And I was like, I can do that on my own, like on my own time. While I'm in pharmacy school, I'm a broke student, let's definitely do this. So that was kind of the origin there.
You were getting paid for it.
Yeah, luckily.
Wow, that's cool. Did you pick up some cool experiences there as far as what brought you into the RX radio show then? Did you learn about stuff, or did you already have that background with audiovisual, etc.?
So at the time, the company was so new, I don't know if I fully grasped what they were all going to be doing. And we did not get exposed to any other parts of the business or any other parts of the technology. As a student, all we knew was how to create these scripts. So I actually did not have a foundation. And even before that, I didn't really have a foundation in media production. My friend that helped me with getting to where I am today is Google. I literally started Googling everything. I started just researching Google, YouTube, watching videos. If I ever wanted to learn about how to make my own graphic without knowing, or a website without knowing how to code, I would just go to Google and try to search that. So unfortunately, I didn't get a lot of exposure when I was a student with VUCA at the time, because I was just creating those medication education scripts. But it wasn't until a couple of years after I graduated that I realized, being the type of person I am, I feel like I'm great at communication, especially in person. Like, how do I scale this? How do I start to communicate with more people and start to build my brand that way? And that's kind of where the digital media production side started kind of coming out of me.
So today we're talking about these QR codes. I now know what QR means.
Quick response.
Quick response.
Yeah.
Every time I would come up to a QR code in the past, it was totally opposite of quick response, because I hadn't used enough of them. I didn't know what program I needed to use. And I thought, oh crap, I'm just going to type the web link that's typically down on the bottom of those things. But your stuff now really lends itself well to QR codes, because if you had every medicine with a different website, you'd start to get into some kind of funky websites that people would have to type in instead of using their camera. There'd be hundreds and then different strengths and different, maybe not so much the strengths, but different dosage formulations and things like that. So that QR code must really help.
The interesting thing about the QR code is, if you think about the history of it, well, it was almost before its time when you think about like a QR code, because what happened was,
exactly,
the QR code was essentially invented, but there wasn't an easy way to read it. So what people normally had to do was they had to download a QR code reader as an app.
Yes.
So there's a lot of friction there and a lot of steps that you had to do to be able to understand how to even use it.
Right.
Now, what happened a couple years ago, Apple and Google did us an extremely huge favor, especially for our business, where they now have embedded inside of the camera for most of every single Apple product, like whether it's an iPhone, an iPad, like a tablet, those cameras all have a QR code reader built in. So all you have to do is open your camera and hover it over.
Yeah.
Whereas prior to that, you had to download that app. The problem is that even today, a lot of people still don't know how easy it is to access a QR code.
Right.
And Apple, it's almost like they did it in secret. Apple didn't really tell anyone that they put a QR code reader in every camera. But it's interesting because other cultures, like if you look at Asian cultures, like QR codes are everywhere.
Really?
For everything. And we're really behind on it, but it's also a function of when it was created, people didn't really know how to use it, and they just automatically started assuming that that's just not something they're going to deal with. And then when Apple created the, embedded it in all of the cameras, they never told anyone. And there's never been like a huge marketing push to say like, let's start using QR codes more often now. So it's
right.
It's definitely been interesting.
I've got an Android and I didn't know it. I'm like, where's my app? And then even with my team, when I say, well, here's how you do it, you put your camera over it, and they all want to take a picture. I'm like, no, you literally hover your camera over it and you don't touch anything and it comes up.
Some Androids though, and depending on the Android phone you have to have, I think either the Google Lens or the Google camera. If not, with Android phones, you do have to have an actual QR code reader. So
I see.
And that's a function of Android having like, I think multiple like operating systems, I think. So it just depends on which one you have. But for Apple, it's every single device that has a camera.
Because there is someone on our team that has an Android, and I bet that's the case where they're not using the Google camera.
Exactly.
Or don't have that downloaded.
Exactly.
Oh, that's really interesting. One of the bigger, more popular computer firms says we're putting this on every receipt.
One thing I think that's really interesting to think about too is for a while now, a lot of people will say, well, most of my patients are above 50 and they don't have smartphones. And I'm thinking to myself, I'm like, first of all, I FaceTime with my 90-year-old grandmother.
Right.
So like,
Right.
I'm not sure how that makes sense, but then, that's personal, anecdotes and things like that. But then I went and looked at some data, and there's I want to say it's over 50% or almost 60% of people above 65 own a smartphone or an iPad or a tablet.
Yeah.
It actually goes up to like 70 something percent when you look at least a tablet at home. So I think there's a misconception now with how technology is being utilized.
I think you're right.
And I think we're underestimating, the population of people above 65. We're underestimating the things that they're actually doing with technology. And then this isn't extremely complicated. You just have to know how to open your camera.
Yeah.
So it's been great in terms of realizing that this is something that we need now. Every patient that has access to a smart device or internet should have access to this. So we're excited for that partnership to really start to get. Our goal is to obviously get to every pharmacy in the country. And this is really a great step in that direction.
I wonder if that population, if even the computers skipped some of them. In other words, if some of them went from, like my mother-in-law, I mean, she never would have had a computer, and she failed miserably on a tablet using Facebook.
Yeah.
But at least we tried. We never would have tried it with a desktop or a laptop computer or something like that. And now people are saying, hey, I'll try a phone with my mom or dad or someone, more than they would even say I'm going to try a computer or a laptop maybe.
And what I think is actually going to be interesting one day, we're in the beginning stages of it now, but I think there's some people that might jump to a voice device over a potential smart
You're absolutely right.
device, a smartphone or something like that, because a voice device like an Alexa is just so easy to use. But I think you're right. I think you have a really great point. The way that I think, this is credit to Steve Jobs back in the day. I mean, the way that he created such a device that's so easy to use in the iPhone, it just makes complete sense that the average person, if they're being introduced to technology, it's better to hand them an iPhone than to hand them any sort of PC or Mac computer, because it's going to be much easier for them to use. And the way that things work now is they can probably do everything that they need to do on their smartphone that they would have needed to do on a computer anyway.
Yeah. Now that voice is really interesting, because if you think of like playing 20 questions, how narrow you can get down stuff with just 12 questions or something. But you think about if you had Alexa sitting there and you ask some, let's say, elderly person or whomever, hey, how you feeling today? Oh, not so well. All right, well, now it goes down this direction. Mm-hmm. Why? What's this? And so you're having this conversation, and within 7 or 8 questions, you might have almost been able to diagnose how they're doing and why that day. And that's going to be really something when that starts coming.
And what you're going to start seeing too is this is already something in the works with different companies, but soon patients are going to be able to refill their prescriptions using Alexa. They're going to be able to say, hey, Alexa, please refill my inhaler, or that inhaler I got last month. And that's going to be something that's going to be connected to the back end. So that's probably going to happen in the next couple of years. It's definitely really fun to see where technology is going. And I'm glad we can I'm glad the QR code is probably an introduction to a lot of these new technologies to patients with kind of digital patient education.
Just thinking about the voice I still know a lot of people have never been to a podcast. They don't know what a podcast is. Android only has like 2% of the podcast market right now. Every week when I put a podcast out, I put a little ad out that just says, to listen to this, just say, hey, Alexa, or hey, Google, play, and then the name of my podcast, and the last episode comes up. I don't know what kind of response that gets, but I know some people still don't know how to get into a podcast or, where to go for that.
Yeah. I mean, it's interesting to think, there's people that I know that just started listening to RX Radio, the podcast I run this year. And they tell me, well, I just started listening this year. And then like soon after, like, yeah, it's my first podcast I've ever listened to. It's amazing. I'm just like, wow, it's crazy that, and this person's probably, in their 20s,
Yeah.
And they're just now starting to listen to podcasts. I mean, it's definitely interesting, but it's growing. I think we're seeing an interesting time now where podcasts had this like huge kind of like upswing and uptake, but a lot of it was, a lot of listenership happens when these people are commuting. So now with the pandemic, obviously with less commuting, now people are listening less. So it's definitely in a weird place now, and I'm wanting to see how it's going to rebound.
I've seen those numbers drop. Have you seen some of that on your episodes?
Yes, I have.
It's pretty interesting.
Yeah, it's global. Like almost, if you look at like a lot of reporting with like global podcasts, I mean, it's globally down. So
I was telling my wife, I said, "Oh, this sucks." I said, she's like, "It's the quarantine."
Yeah.
They're out of their routine.
Exactly.
Dumb this down a little bit because I don't want to hop over some of the listeners. Inform the listeners on exactly what we're talking about here.
Yeah, so I can definitely go through kind of a little bit of the basics of it, how it works.
Yeah.
The two things that are great about this solution is that one, they get a short 2-minute video about their prescription.
I see.
And we have an extensive library that covers about 90% of medications dispensed in a pharmacy. So if a patient's picking up Metoprolol XL, we have a video for Metoprolol XL. If they're picking up a Pro Air, we have a video specifically for Pro Air. So that QR code gives them access to these videos that kind of tell them what the medication is used for, how to use it properly, side effects to expect. And they also have administration videos to help people with like injecting like a Humira, for example. And the videos are short. They're about 2 minutes long. They're written at a 5th grade reading level, and the content's all created by pharmacists. So there's a minimum of 2 pharmacists that review every script that gets created. And which is great because it's not intended to replace counseling, and legally it cannot replace counseling, but it's intended to be a mimic the conversation that someone would have if they have a quick question about their medication. So it really should provide for more fruitful conversations with patients and their healthcare providers. The other really cool thing about this solution is that all the information that patients normally get on paper, whether that be the patient ed sheets or the med guides, all that information they normally get on paper, they can actually now get digitally through that QR code. And what we've done is we've reached out to 49 different boards of pharmacies to ensure and confirm that this is something that pharmacies can offer as an alternative. So we initiated a Going Green campaign something like 5 years ago, basically advocating for pharmacies to like stop wasting so much paper and provide this digitally. So we have some pharmacies that are reporting that they've virtually gone paperless with all their patients getting their medication guides and the patient ed sheets through that QR code. Now, pharmacies can't make this all or nothing. The patient still has to have the option of receiving paper.
Gotcha.
But most patients throw that stuff away because they've either been on the medication for so long, or it looks it's too much for them to read, which is why the videos are great a lot of times.
Yeah.
And pharmacies are saving time by not having to deal with all of the finding the paper, folding it, putting it in the bag, and then HIPAA mix-ups happen.
Yeah.
Being a pharmacist myself, I know that I'm trying to make things really efficient. I'll have verified 10 prescriptions, and now I have 10 things laid out. And I need to make sure the right paper goes in the right bag. One, that takes time, and two, sometimes the wrong paper ends up in the wrong bag. It's an unfortunate reality that going paperless can actually prevent. So a lot of great benefits to this solution.
Yeah.
What's interesting about Pioneer is they're initiating this on every single receipt for the customers. Traditionally, that QR code goes directly on the bottle. What I would encourage, if there is a Pioneer pharmacy that's listening right now and you're getting this on your receipts, I would reach out to your account manager to ask to get that QR code on the bottle because it is possible to get there. And I highly recommend it. It's how we normally operate. Having that QR code on the bottle keeps it close to the medication. And the QR codes, what's really great about them is that they're NDC specific. So we know exactly the NDC that the patient's getting. And that's why it allows us to populate a lot of the things that are required by, whether that be the State Board of Pharmacy, the FDA. One other feature that I'll talk about too is people can actually see the images of the medications.
The QR code can get pretty small, right? I mean, you could have that like a 1/4 inch by a 1/4 inch and still be read by a phone.
Yeah, 13 millimeters is like what we tell all our pharmacy management system partners. That's how small it can be, which is usually the size of like an average thumbnail.
And that would go on the bottle somewhere in the corner or something like that if you wanted to get it per bottle.
That's correct. Yep. Yeah, the bigger the better, obviously. But you have states like California, which is really interesting because California has labeling requirements that have like the font on the label that like says the medication name has to be a specific size.
Oh,
and they have to have certain things on their label that actually require sometimes an impossibility to get a functional QR code on that label. So sometimes there are challenges that we have to kind of try to figure out. But yeah, usually it goes right on the bottle, and obviously the bigger the QR code is, the better it is to be responding to a QR code reader.
Gotcha.
So the smaller codes, it's a little bit difficult to like, you have to like play with a little bit, like in terms of how close you might have your phone, making sure your phone is focused, the camera's focused on the QR code. Larger QR codes, it's much more easier to pick up. So the larger the better, but we do recommend a minimum size of 13 millimeters. Being
the Business of Pharmacy podcast, let's talk money. How's that work?
The way our business model works, this is in general. This is no matter the type of customer we have. We don't get funding, and we don't have any sort of backing from pharma. And a lot of times companies that provide patient education have like pharma that sponsors, and they get sponsorships and things like that. We don't have that sort of business model. Primarily, we license the content directly to the healthcare providers. So whether that's a health system, whether that's a specialty pharmacy, a health plan, we have customers that are health plans, whether that's a community pharmacy, our business model usually works by licensing the content directly to that healthcare provider.
Licensing meaning you've got an agreement, a business agreement with them. They're buying the access to that.
Yeah, and they would pay what's usually a yearly subscription fee to that. So they would pay us directly to subscribe to the content. So we say subscribe because it's almost like Netflix, where we're giving you all this content that you can now use and provide to your patients. And all this content is ad free. So even though we have medication specific videos and content, it's not an ad for some company. These are all independently created by clinicians, by pharmacists, that only get the information directly from the FDA and NIH.
And you promote that somewhere. Probably you say, we're not going to be bought. We're going to have very unbiased material and so on.
We don't heavily boast it, which obviously that is a marketing technique, but it's not something that we have, clearly laid out on our website. But just from a core, from our integrity standpoint as a business, it's not to say we won't work with companies like pharma manufacturers or anyone that is pushing something that we might have a video about. But we just want to be extremely clear that the content that we create is unbiased and is evidence-based, based on FDA approved package labeling. So it's nothing that, and we are never, paid specifically to say something in our content, in our video content. Our goal is just to educate those patients as best as we can.
You would work with a company somehow. That's not out of the question.
Definitely not. No. So we would work with any company. It just becomes in terms of depending on if someone wants us to create a video for them, we'll create a video and hand you the video.
Gotcha.
But in terms of a relationship where we're licensing content to a healthcare provider, and then they're now showing that to their patients, that content is going to be evidence-based content, unbiased, not influenced by any outside company or organization in terms of what information their patients are getting.
Is that one of the reasons why you would not promote it? Because you don't want to paint yourself into a corner?
When we create content, we're creating new content. We're creating about 50 to 60 videos every quarter. Is there some drug rep that may reach out and say, hey, we have this launching, can you please do a video for us? What we'll do then is we'll put it in our content queue and we'll have our content team evaluate it. If that is going to be a first line therapy or it's new in its class, we might do that video. And it has nothing to do, like I could hate that rep or I could love that rep. It has nothing to do with my relationship with that rep. But do we need to get information to patients about that medication? That's the concern that we have as a content creator. So no matter who is telling us, we will still consider doing that video. Now, if the drug rep said, hey, please make sure to mention this or don't mention this, we don't listen to things like that.
Your Bible of this is really the patient information guide, which
exactly.
We're all hoping the FDA isn't bought out, but you're using very unbiased source material to get across what you need to get across.
Exactly.
Gotcha.
Now there's kind of two ways where we will create our revenue stream.
Yeah.
The organization that is utilizing the service or the solution, they may upfront cover all the costs. And then on the other end of it, they could either then charge their pharmacies, which in Pioneer, this is not the case because this is now offered to Pioneer pharmacies at no extra cost to them. So they could either charge the pharmacies or they don't charge the pharmacies and just completely realize that this is a value add.
Gotcha.
And use it as like a marketing tool, let's say, to say, look, we have this, it's no extra cost to you, things like that. Now, what's interesting about that is some of our other types of customers, they don't see a direct ROI like a community pharmacy might. They might not see that they can immediately save paper and toner like an independent pharmacy, because sometimes we just license the video content. And what we say is like, look, yes, you have to pay for this up front, but you having this video content is going to help you build your brand with your patients better, or it's going to help your patients become more adherent. So what Pioneer might see, or someone like Pioneer might see, that a pharmacy never switches away from their pharmacy management system because that means they might have to start paying for MedsOnCue every month. Yeah. So there's a bit of a branding benefit there, a marketing benefit that they're able to see. But at the end of the day, it's either the organization that we license with, that license our content, or the pharmacy themselves will cover the cost from a yearly licensing perspective.
And there's some pharmacies that they can go directly to you.
Yes. So that's normally how our business model works. We work, even though we're integrated with almost all of the major pharmacy management systems.
I see. Gotcha.
We work with Liberty. We work with RX30, ComputeRx, Micro Merchants, PDX. Like, we work with all of the major pharmacy management softwares. It's just usually individual pharmacies will license the content or license the MedsOnCue individual to their own pharmacy, and they would pay them the licensing fee.
The relationship with Pioneer giving it to everybody, is that rather new?
They're not the first that we've integrated with, but they're the first to provide this to every one of their independent pharmacies. Our first integration was with RX30 back in like 2013, I think. But again, we're integrated with almost all of them. But they've mostly been just an individual basis. Individually, if the pharmacies wanted to have this and sign up, they would. But Pioneer was the first one to take the leap and say, look, we want this to be a standard feature in every single pharmacy. So let's get this relationship in that position.
Yeah, congratulations to you guys on that. Do you have any plans to monopolize on people saying, oh, this is so easy? Now that it's on here, will you have anything else that you're able to offer to, let's say, a Pioneer pharmacy that says, hey, VUCA is so cool. Oh, we're going to now use the VUCA this, that an individual pharmacy will come to you?
We will in the future, but nothing yet. I have a lot of ideas as to what that's going to be, but we have a lot of work to do with our current product first.
Yeah.
Before we start some of our other value-added services.
All right, don't give away any company secrets, Richard, but give me just a taste of what something else might be.
I mean, a taste of something else might be would be anything that can help a pharmacy stay competitive. We're going to help them with,
Based on communication, or not even necessarily that?
Based on communication, whether that be marketing, whether that be communication with their patients, educating their patients. That along the front of making sure that their patients are well educated with their health, and their medications, and being that I feel like, I try to put myself in an owner's position as much as possible, and I feel like if I'm an owner of a pharmacy, the better relationships that I can have with my patients, which usually comes from communicating with them the best, is the better I'd be able to retain them and continue to have a striving business. Yeah, especially because I think that independent pharmacies specifically, and I think this is retail chains, but independents as well. The model, the revenue streams are changing significantly, and they're going to continue to change significantly.
Yeah.
And I think as pharmacy owners want to continue to adapt with that, they're going to need to have a capability of communicating better with their patients than their competition.
Gotcha.
To continue to like bring in those revenue streams. So we're going to try to be in a position to help them do that as the years go on. The way that my current vision is, I don't see us providing something to pharmacies that they can then turn around and directly charge a patient for.
Gotcha.
I don't see us being in that role in the near future. I mean, obviously, you know, something could happen and we can come up with a new plan.
Right.
I see it on the other front of no matter what it is that your pharmacy wants to do, we'll try to see how we can best help you communicate that and educate your patients.
Gotcha.
On their health and medications, and make them want to continue to use you and have you as their pharmacy.
Gotcha. Yeah, there's a million things. You know, there's sons and daughters that live 2 states away, and there's a 95-year-old mother in the nursing home. And if you could at least get the communication part down, you've solved a lot of problems for people, you know, without directly charging in that capacity for it.
Exactly. Yep.
Richard, we all learn by our mistakes and so on. Is there anything that you would have done a lot differently since you've been there? Maybe a path you went down that you kind of wish you hadn't, or something you maybe missed on that you're playing catch up on now? Or has everything kind of been enough just of learning experiences and then you're pretty happy where you are?
With VUCA specifically?
Yeah, with VUCA.
Luckily and fortunately, I haven't seen anything that we've done misstepped on yet.
Yeah.
Now, I think that there will probably be something in 5 years from now that I may have been like, man, I should have looked at that in 2020.
Sure, look back on. Right.
But right now, I think we're growing, and we have a lot of plans in place that are trying to capitalize on as much opportunity as we can now in terms of growth, in terms of the type of content we're creating, in terms of our marketing strategies.
Right.
So unfortunately and luckily, I can't think of anything specific that I can say. Here's one thing that I will say that I've wanted to do and I haven't done yet. I know eventually we'll do, and I'm not in a rush to do it. But one thing I do want to do is be able to provide like an Alexa briefing, or some sort of like briefing on new medications or updates to medications that have come out. I know that that's probably something I'm missing out on now because I'm not executing on. And I think being a content company that creates content about medications, we should be able to do that. So that's something I'm sure I'm going to regret not doing more on. But we're trying our best out here. So, but eventually we'll get there.
A briefing where a healthcare worker can say, "Tell me about the new drug that's out for such and such."
Play the VUCA briefing for today, and it would just be a briefing about today's news of either information about a quick medication, mostly for healthcare providers, whether it's a refresh or recap, or telling them about a new medication that just got approved,
right,
or a new health warning or new like black box warning that just came out or something like that. I want to do something like that, and we'll do it eventually because we should have the infrastructure to do it, and do it where it's like either daily or weekly,
right.
But we have a lot of marketing strategy and initiatives that we're working on for this year that we'll be launching. So, and that might be part of it.
What are you using, favorite programs you're using to manage all this as far as project management software and so on? Are you using anything interesting?
RIT has like their own project management thing that they utilize. I'm not heavily involved in that. I think they use something called Basecamp or something like that.
I just looked at Basecamp today. I haven't touched it in like 3 years. And so they said, do you want to lose your subscriber name or something? And then in the meantime, I looked at it. So they've got some cool stuff going on now. Yeah, pretty interesting stuff.
I have my own tools that I utilize. Like I use Microsoft Lists. I think that's really helpful for me to keep organized. I produce a lot of content on Canva.
Oh, I love Canva. Yeah. Love Canva.
Yeah, but Basecamp is what like our IT department uses when they're working on things.
Do you even have an account in that, or you're just like, nah, just leave me out of it?
No. I let them take care of it. If they need me for something, we have operational meetings that I go through, but I'm in the weeds on certain things. But on the IT side, we provide them with direction. This is what we need done.
Cool.
And they figure it out.
A lot of times it's better not to learn the system as far as what's going on. Then you're like, I don't know. I just tell me, because I can't even touch that. I did that with the pharmacy system for the last few years, but now I'm pretty heavy into it. But it's a good excuse sometimes.
A lot of times it's just, that's why you have an IT department, it's so they can do that stuff and you don't have to like worry about it. You can worry about the other things. So
absolutely. Today's a work day. You're a busy guy. I got the day off for some reason. I'm just going to go hang out back in my kitchen and have my next snack for the day. But you've got places to go and people to talk to. But thanks so much for spending time with us today.
No problem at all, Mike. Thank you so much for having me on. I really do appreciate it. And hopefully I can make it back on sometime during the year.
Thanks a lot, Richard. Nice to see you.
Likewise.
Nice talking to you.